Hello everyone and welcome to our show Around Kuwait. This is your host Abdulaziz Darwish. As usual in our show, we're shedding the light more about the latest events and occasions happening in our lovely country state of Kuwait, because you already know our working crew traveling everywhere to share with you at different events, and sometimes we have a distinguished guest who's gonna join us in our show, talk about different perspective and fields and even interest. And before we start, I would like to greet our working crew and also my colleague Sarah. Hello Sarah.
Hello Abdulaziz, and hello to you and your viewers and everyone who's watching us through KTV2. Welcome to Around Kuwait. As my colleague Abdulaziz said, we have various of segments, and also let's talk about the trend about all around Kuwait. But for today we have a really special guest. We're going to talk a really special topic about the childhood trauma.
Childhood trauma, because you know, like the first we know trauma in the world when the child getting birth and he's already crying.
Yes.
And to know more about it, we are pleasure to have with us today Dr. Abdullah Al-Khanfar.
It's a pleasure to be here.
Thank you so much for joining us.
It's a pleasure to be here. Thank you for having me.
You are most welcome, Dr. Abdullah. It's really a deep, let's say, topic we're going to discuss about today. But first of all, we'd like to know more about yourself, Dr. Abdullah.
Sure. So I'm Dr. Abdullah Al-Khanfar, graduated from medical school in 2020, started in Jordan University in Jordan for like 7 years, graduated from university and started in Ministry of Health in 2020 during COVID times.
Yes.
And finished my training year for like 1 year in the hospital rotations. Afterwards, I joined the family medicine department. And since then, I'm working in family medicine for 3 years now.
Mm-hmm.
Nice, amazing, and a very good CV. Thank you so much for joining us. You mentioned you've been here during the COVID time.
Yes.
And a family medicine, and you're focusing in child trauma. How was that time when you've been, like it's a very severe case that time when you've been in?
So when we talk about, let's say, COVID times itself, it was traumatic for individuals, for citizenships, and for doctor and physicians as well. So transitioning from hospitals and dealing with COVID to family medicine, it was a bit chill, let's be honest. It was relaxing,
yes,
because when we deal with patients like various, let's say there is like different kind of an approach comparison to hospitals when dealing with patients. So in family medicine, it's a little bit relaxed, intimate. We deal with patients on, let's say, on a personal level or on a deeper level or a deeper sense, some might say.
Yes, that's amazing. So childhood trauma,
Childhood
Dr.
trauma.
Abdullah.
Yes.
So how actually did it become really an interesting in childhood trauma?
So being interested in such topic was because of a question I had when I used to be a student in medical school.
Yes.
So I've always had this question: is do symptoms or do physical symptoms, also diseases, only stem from conditions, only stem from environments? And since then I was introduced to the term childhood trauma from brilliant doctors such as, which is American doctors such as Peter Levine and Gobermate, which is he's Canadian,
yes,
and the French doctor herself, Lisa Bobo. They all discussed childhood trauma and the effect of childhood trauma on physicians and on patients.
And also in addition, Dr. Abdullah, we know like sometimes maybe we do some actions, even we are all adult, maybe it's referred for our childhood trauma, right?
Exactly. So any type of events that happened during childhood can manifest in our adulthood. Let's say you were neglected. Let's say your parents didn't give you the love you needed. Let's say you were subjected to injustice, or maybe you were bullied. And some might say, so
it's high demand now, the bullying.
Exactly, so the bullying now, it's a trend, or the metaphor itself, it's a trend. But like any kind of event that happened during childhood, especially between the age 2 years to 7 years old, it will manifest later on in our adulthood as, let's say, diseases, conditions, psychological problems as well.
So neglected, ignored, let's say beaten,
verbal abuse, physical abuse,
yeah,
even sexual abuse, whether it's taboo or sensitive to talk about these topics nowadays, but it has an effect on the individual itself in his later on life.
Yeah, I know the old generation, they say when you beat your child can be really raised very well.
Yes.
This is the old thinking.
So this is the old thinking, the old programming we inherited from our, let's say, older generations. It's a type of restriction. It's a type of, like, let's say, manipulation, how to handle yourself by like beating, verbal abuse, all manifest as diseases later on,
yes,
such as stressful events, generalized stress disorders, maybe also ADHD, also depression also manifests from beating, from verbal abuse in childhood.
That's amazing.
So see, this all kind of symptoms and even a kind of actions, you all rolling them up, all of them, to have a lecture. You always been attending the conferences, and you are a speaker.
I am.
How can you share this knowledge to your audience during the conferences?
So when I practiced in family medicine, I noticed a lot of patients that come to me with symptoms that are not related to just medical conditions. So I decided to open up like a speaking place or a lecture where we can discuss these type of topics and raise awareness toward childhood trauma and the effect of it on the individual later on. So let's say, as we mentioned, the patient, maybe he was verbally abused or maybe he was beaten. We discussed these type of issues or scenarios that happened to him during his childhood and what might happen to him later on in his life. So maybe a patient came to me to the clinic complaining of physical symptoms, but there is no medical condition. So what's the problem? When we go through the history of the patient, so there is beaten, he was beaten in his childhood, he was verbally abused, he was bullied, and this is the solution, this is the problem back then. So it stems in his childhood, manifests in his adulthood as a conditions.
You mentioned earlier, Dr. Abdullah, about how it's really important to know about that childhood trauma, especially for physicians and let's say the doctors and so on. So why actually do you believe it's very important to address childhood trauma in the medical practice as well?
So most conditions, especially when we talk about diseases nowadays, especially stem from traumas in general, whether it's childhood trauma, whether it's traumatic events, maybe it's an accident, maybe it's the loss of a loved one. A grief itself, it's a stress, let's say emotional stress that subjects to the patient himself. So let's say a patient comes to me with an autoimmune disease. So most of autoimmune disease studies have shown that stem from traumatic event. Nowadays, we need to identify what's trauma. Trauma is a constriction of self, a separation of self. So all traumatic events are stressful. Let's say the individual is subjected to trauma in his childhood. There is a stressful, let's say, stressful lifespan. He will go through he will go through his own life. So we need to discuss these stressful events that went through his life.
Amazing. So we always study the history of any case you already faced.
Exactly.
So can you mention some of the case you will not forget and you already cured?
For sure. So I had a patient who is like 42 years old. He was like a man, he was a man, healthy, complained of physical body aches for 3 years, didn't know what's going on. He thought that he had like some sort of autoimmune disease. He went abroad, he sought all kind of consultant, let's say, sought help in different variant kind of a way. And when we went through his CV, we knew that he was stressed through his job. So he's a manager in a place who's very stressful. He didn't sleep well for 3 years.
Taking quick decisions.
He takes major decisions. He's like, he controls the money, he controls the people that works below him, and he's always stressed. He does not sleep. And he didn't know that these physical symptoms escalated due to his stressful events throughout the course of 3 years and manifested as physical symptoms nowadays, where most doctors around him thought that he has a condition. He thought he had some sort of a disease, so they referred him to the orthopedic, they referred him to the let's say the rheumatology department, and he was cleared by both departments. So when he was referred to family medicine and we discussed the history of the patient, he then discovered that because of the stressful, let's say, position he was held, because he was promoted 3 years prior to his conditions, and due to that promotion, even though it was money-wise, he was happy, but let's say physiological or physical-wise, he was like, there's a decline.
Yeah, that's amazing. So this is one of the cases, let's say.
One of the cases of all, let's say. Most studies have shown like most autoimmune diseases do stem from grief. So if like I have a lady in her late 30s, she has some autoimmune disease, maybe it's LSLE, maybe it's MS. When we go through the history of this lady, we would find that she had went through grief states of her life. She didn't deal with that grief. She didn't acknowledge. She does not know that the reason of her autoimmune disease nowadays is because of grief 2 years prior.
This is the problem, actually. They actually don't know exactly what they are suffering from. It's a childhood trauma. So you mentioned 2 cases. So let's know more about, let's say, some of the common manifestation of childhood trauma that came across in your practice.
So as I said, trauma by definition is like a separation of self, a separation of the body. So most of conditions that happen because of childhood trauma is physiological, let's say, conditions, or psychological, such as ADHD, depression, or maybe derealization, which is separation, the sense of separation of someone's body. He feels like he's not in his body because of the traumatic event that embedded, or let's say it was on his mind, body, and immune system.
Yeah.
Later on, he would develop various conditions. We can discuss like a lot of conditions, but we can simplify it. We can say the trauma itself embedded on the patient, on his body, mind, and immune system.
And also in addition, even you have, like we mentioned, like before the breaks, about the self-healings lectures.
The self-healing lectures.
So
yes.
let's talk more about the self-healing. Like it's a good thing about you, Dr. Abdullah Al-Khanfar. We are investing you are with us today in the studio, and you give lectures to your colleagues and for the audience about the self-healing, how to curing ourselves.
Exactly.
Why it gives you the responsibility to share about this knowledge?
Because there is a misconception, first of all, about the word healing.
Yes.
So healing nowadays is a trend. What is self-healing? Maybe it's just doing, let's say, physical work. Maybe it's just meditation. Maybe it's just writing or expressing your feelings. Well, in fact, healing is returning to your body,
Nice.
returning to yourself,
Yeah.
living your authentic self, taking accountability of your emotions, knowing how to express these emotions when you have them. Maybe you're going through sadness, maybe you're going through grief. There is some sort of apathy, which is indifference. So when you take accountability of yourself and know how to express yourself, these will help with the healing process. So the misconception we have nowadays about the word healing, in my lectures I raise awareness about what is healing. What is the process of healing? Is it an endless stage, or is it an ongoing process? Because some people might think healing is like a cure, because there's a difference between healing
Yes.
and curing. As a
Yes.
medical doctor, I can give you a medication and you're cured.
Yes.
But when it comes to healing, no, it's like an ongoing process, an ongoing work on your inner self. Exploring your inner self, whether it's going outward, we will go inward for the patients.
That's amazing.
Yeah.
Yeah, so as you mentioned about the awareness, I know the awareness really raised up for the past
Yes,
years,
for sure.
especially as you mentioned about the bullying. I know everyone is talking about the bullying.
Yes.
So let's talk now about the communities and their support. Do actually the communities support the individuals who have experienced, let's say, the childhood trauma?
So the rule of my lectures is to have a community. That's rule number one.
Yeah.
So I don't do like one-on-one, let's say, lectures. I do like a community-based lectures. So community itself will give you the sense of belonging, which is the number one way in healing, to feel like somebody else is feeling the way you're feeling. You're not alone, you're not isolated. Our old generations have, let's say, positive aspects. They have a huge community.
Yes.
When we make a small difference between men and women, when a man goes through a problem, he wants to solve it alone. I want to solve it by myself. But when a woman has a problem, she will call her friends. She will call her ladies. She will call the ladies in her community, which we can benefit from that, from the ladies, that they love the sense of community when it comes to healing, when solving problems. Us men don't do that because of our higher ego.
Yes.
Okay, so sometimes community do help in the healing process. It gives us a sense of belonging. It gives us a sense of safety, security as itself.
So when you do this kind of lectures, our guest, Dr. Abdullah Al-Khanfar, how you cooperate with your colleagues? I know Everyham has certain lectures, you do
Yes.
self-healing. How is that like cooperating, and as an individual, you are dealing with experts and even amateurs?
Yes.
Tell us more.
So when it comes to dealing with the physicians or the medical doctors, we approach them, we teach them a new approach on how to deal with patients. So let's say he's a dermatologist, or maybe I'm dealing with a rheumatologist or someone who works in gastroenterology. I would tell him, like, asking you kind of questions when you talk to the patient. How is the relationship of the patient with himself? How is the relationship with his peers? How is his relationship with his husband, or with her husband, sorry, or with his counterpart? So these type of questions will help us identify the certain of a problem.
Yes.
Because most people, maybe they are in a toxic relationship. Most toxic relationships causes stress, high cortisol levels, we will have conditions, we will have problems.
Yes.
So dealing with these type of, let's say, new way of approaching the patient, or let's say a different kind of an aspect when dealing with the patient, will help physicians to know how to treat patients in a new manner. As you guys know, the medical field is always in developing. Always there is a new ways to approach patients.
Nice.
The old programming is not beneficial anymore.
Yes.
It's not beneficial to us doctors and the individuals themselves.
That's amazing. Well, Dr. Abdullah is really a deep, interesting, and important topic.
Yeah.
So, dear viewers, don't go away. We'll continue with our dear guest after this break.
We are back to our show again around Kuwait, dear viewers watching us through the KTV2. Today we have a special episode with our distinguished guest, Dr. Abdullah Al-Khanfar. We spoke already in the beginning about the self-healing lectures already mentioning because he's a family medicine, and even about the childhood trauma. So now back again. We spoke at the end how you deal with this expert and amateurs. We'll talk about the self-healing.
Yes.
So when we talk more about self-healing, so how about like maybe some of your patients join, like how do you communicate with your patients?
So what are the steps? Let's say, how can I explore self-healing when it comes to patients? So rule number one when dealing with healing is, first of all, having agency, which is taking responsibility of yourself. There is no room for blaming anybody else. Let's say you had a childhood, let's say you have a traumatic childhood trauma, or let's say you have traumatic events, You cannot blame your parents. They didn't know well back then, so you cannot now blame them when you're a grown-up. You need to take accountability for the emotions you're feeling. Maybe you're feeling sad, maybe you're envious a little bit, maybe you're jealous as well. So these type of emotions, you need to take accountability to address them. Secondly, we can use authenticity. Are you willing to express yourself in an authentic manner? We cannot tell the patient you need to fake your life through masks you wear them to adapt into communities. So let's say trauma itself constrict the patient to express his authentic self with the peers.
Yes.
So let's say the second step is to express yourself authentically. Thirdly, we can tell the patient to deal with his emotions. So how to put strict boundaries with him, or let's say with his environment, how to use these boundaries to his benefit. So most people that are subjected to trauma are a little bit sensitive, are agitated, are angry. So how to deal with that anger during putting strict boundaries with the community you're dealing with or with the environment you're living with. And lastly is compassion. You need to have some self-compassion with yourself.
Yes.
You cannot just blame yourself. Most patients that come to us, they do suffer from self-hate, self-loathe, shame-based personalities due to these traumas they were subjected to. So having the way to have compassion toward yourself. The same way as when you guys do have these compassion to your friends when they have problems, use that compassion inwardly to yourself. So we help patients to look at yourself not just as a patient or as a victim, but like these trauma helps you develop who you are today. So this is like, let's say, a source of strength for the person himself.
Exactly. You pointed out really an important, let's say, issue, Dr. Abdullah, about how actually we can treat ourselves.
Yes.
I know we have a lack of knowledge and lack of awareness. How can actually we deal with the emotions, thoughts, thinking? I know a lot of, let's say, in our community, when they are angry, they're angry.
Yeah.
When they are sad, they are sad. And they can transfer that for all the surroundings around
So
them.
there is a kind of inheritance when it comes to emotions.
Yes.
These type of programmings and these type of, let's say, negative emotions, whether it's anger, whether it's resentment, apathy, these emotions, if they are not, let's say, managed, regulated, they will be inherited to the offspring.
Yes.
Maybe I'm a father, maybe she's a mother, and she will give these feelings to her children because she wouldn't know how to handle herself, and the children will see, or let's say he will copy his mom or his father, so he will act the same way. So for people that, let's take one emotion, which is anger. We cannot lash on people if you have like anger issues. So we will tell the patient, express your anger through a healthy manner, which is set your boundaries, set your tone, know how to deal with other people without shouting, without lashing out. Maybe you have resentment, know the source of resentment. Resentment also reflects something that you didn't have or a need that wasn't met. So try to meet that need now instead of like having resentment for not having it. Most children, let's say, they were neglected in their childhood. They didn't have any type of love, or they weren't, let's say, held. So their source of love nowadays, or their love language nowadays, is to be touched, is to be held. So do that to yourself, ask it. So we help patients to help even the self-love, even the, let's say, the hugging, the touching, will help reduce the cortisol level.
Exactly.
Will help reduce the stress.
Reduce the anger.
Exactly, will help reduce the anger. And all of these emotions do contribute into medical conditions, such as depression, such as physical symptoms, fibromyalgia, one of the terms, which is orthopedic. Let's say the department would discuss that more efficiently than me. But one of the conditions that is because of anger, is because of stress, is these physical pains, physical ache we complain of.
Yes.
And also, when we learn about new topics today with you, Dr. Abdullah Khanfar, so we consider some, because the way how you discuss to the viewers and you elaborate all the information about the self-healing, about the childhood trauma, we consider sometimes family medicine as a psychiatrist.
Yes.
What is the difference between you and the psychiatrist?
Let's say they are intertwined.
Okay.
So first of all, there is a misconception about family medicine, which we only deal with minor conditions.
Yes.
But nowadays, family medicine has developed because most people have, let's say, fear. They have like these stressful events when they go to large hospitals. They feel like they don't want to go there. Even if they have serious complaints, they would rather go to a small facility. So Kuwait provided polyclinics in each area.
Yes.
And these clinics now are more qualified than before. We have psychiatric clinics, we have dietitians, we have chronic disease clinics. So all of these are intertwined. So what's the combination between psychiatry and family medicine is that the conditions that you face during family medicine can be treated also in psychiatry. Let's say we have some sort of diseases, maybe generalized anxiety disorder, we can deal with it in family medicine.
Yes.
And we have the medication, and we have, let's say, the CBT, which is the cognitive behavioral therapy, on how to deal with it efficiently. If the patient feels like ashamed maybe, or there is like some sort of what do you call it, like
Symptom?
not just symptoms. Some patients feel like they don't want to go to a psychiatrist, maybe because they are scared of what
shy.
Sensitive in their
sensitive.
life.
There is some sort of a sensitivity when dealing with these type of major facilities.
Yes.
So they would rather come to a smaller polyclinic. They would feel intimate, they would feel personal with us, and they would share what's going on with their lives. So in family medicine, we can deal with them from the psychiatric aspect and the physical aspect as well.
That's amazing. So in versing of the childhood trauma, Dr. Abdullah, how actually do you collaborate actually with mental health professionals to provide a comprehensive care or treatment?
So there are some sort of diseases that happens when it comes to psychiatric conditions. Mainly they are generalized anxiety disorder, mainly
Yes.
depression. Some, let's say, childhood trauma that happened in early childhood would contribute on manifesting of these diseases later on. So let's say this child was subjected to injustice in his, let's say, early life. This injustice will manifest as depression.
Yes.
So there is an intertwine between these traumas and psychiatry. So let's say this patient was abandoned. So this patient will have also generalized anxiety disorders later on in his life. So these type of ways, let's say the childhood trauma and the psychiatric conditions all intertwined together.
That's amazing.
And also there is something else, sorry because of my voice, excuse me, because we're talking about the very interesting topic. So imagine if like a person like me, I am suffering from maybe fear about the surrounding.
Yes.
Maybe I am very introvert, okay?
Yeah.
And I am suffering from too many like anger or depression. How can you fix a guy, he's introvert, to be extrovert and to change his way of life?
So you've mentioned a very beautiful, like, say, example. Introverts, most of them have fear of expressing themselves.
Okay.
So most of the things that they fear is like, if I express myself in front of people, I will embarrass myself. So we would come to this patient and tell him what happened in your early childhood. Did you feel embarrassed when expressing your authentic self in front of your parents? Or maybe he had an embarrassing moment at school. So we would tell him, it's not school anymore. You're a grown-up now, you need to express yourself freely. People will not, even if people judge you. Even if people judge you, you know yourself. You know how to go inwardly and appreciate that sense of self and know how to, let's say, break that fear. So most introverts have the fear of expression. So, and that shows you how they have problems when it comes to their throat. They don't know how to use words. So learn a new set of words, know how to use them. These type of, let's say, small tactics.
Yes.
It's not medically, but it's like a lifestyle modification that we can teach the patients on how to express himself, maybe through writing, maybe through painting. They can use hobbies as well on expressing themselves too.
Oh, they can, let's say, use their hobbies and then express
Exactly.
themselves through hobbies. And I know a lot of people will, let's say, can see them
Yes,
after all.
exactly.
So that's why introverts actually increased after the pandemic.
After the pandemic,
isn't it?
So what happened during the pandemic? Let's say, there is two aspects of the pandemic.
Okay.
There is like the positive aspects and the negative aspect. The positive aspect is most people went inward. They dealt with their problems, the psychological problems. When they went out of the pandemic, they were like, it's time to take accountability.
Yes.
There is no, let's say, escape. You're sitting with yourself, you're dealing with your emotions, you're dealing with your own problems. And the problems that we faced is that people went inward and they closed up.
Okay.
They felt that they didn't want to get out again or live life again because life opened, and people still feel traumatized of the pandemic that happened, especially medical physicians, by the way.
Yes.
Especially medical physicians, it was a very stressful moments for them. So we would see them nowadays as still having flashbacks of the death that we faced, of the misfortunate events that we were subjected to back then. But the pandemic, even if it was negative, it had positive aspects as well.
Nice.
Yes.
And also, how do you communicate with your patient during the pandemic? I know always from the virtual platforms, you are answering their questions, voice calls, video calls. Is it like what that time was very like essential?
It was essential to minimize the spread of the infection, but is it efficient? In my opinion, no. You need to hear the patients, you need to interact with him physically, you need to see his body expression. Some patients didn't open the cameras, so you just heard their voices, but you don't know what's going on in his body language. Most of the patients that come to us in our clinic, we would obtain some conditions from the physicality.
Yes.
Directly.
Directly, I would see the patient. Even when it comes to childhood trauma, I can spot diagnosis when I see the patient. Once he enters my clinic, I would know that this patient was subjected to some sort of stressful events prior to even talking. The way of movement, the way of expressing themselves, the way of the let's say the language they use. Maybe they're agitated, maybe they're like relaxed, maybe they're feared, maybe they're scared. And some people do express these through physical or body language.
That's amazing.
So in my opinion, using Zoom calls or using video calls were efficient to not spread the infection,
Yes.
but the viral infection. But in dealing with the patients, I would consider like dealing with them personally better.
That's amazing. So, doctor, let's talk now about the families, the parents.
Yes.
We mentioned before, some parents actually, they beat their child, they yell on they neglect actually their child. So how actually, in your point of view, prevent, let's say, what preventive measures, let's say, for the family can do to lack or reduce the amount of the childhood trauma?
So in comparison to older generation, the younger generation have higher awareness, have an expanded awareness. So they during their let's say livelihood, when they were beaten by their let's say peers or their parents, they didn't want the cycle to repeat itself.
Yes.
So when they have offsprings or they have children nowadays, we don't see them beat them let's say often.
Yes.
Okay, but how can we let's say teach them on how to deal with these children? Any child will cry, any child will have tantrums, any child will have anger issues because he's still developing his conscious, he's still developing his self. So when a child cries, we cannot just neglect him. You need to accommodate the child. You need to use words with the child. Express yourself. Teach your children on how to deal with words. We have some sort of like, let's say, suppression.
Yes.
Or repression when it comes to expressing, because some people might find it like a source of a weakness, especially men, and some others might find it as like, let's say, misleading, or he's a child, he wouldn't know what he's saying even though he is trying. His cry itself is a source of let's say a sign for you as a parent to understand that he's frustrated. You need to accommodate this frustration, and you need to untie the knot of this frustration and deal with it accordingly.
Yes.
So for parents to deal with their children, they need to know how to speak their language. So they need to know what's this language, or why is he crying. You cannot just neglect him and he would cry himself out of this tantrum.
Yes, exactly.
Okay?
Amazing. This kind of interesting topics were very like we are investing you with us in the studio, but we'll continue our conversation after this short break.
Sure.
So the reviewers that go to this time of it, we'll continue your show around Kuwait. Stay tuned.
we came back again, dear viewers, with our special guest for today, Dr. Abdullah Al-Khanfar, with our special topic. So, hello again, doctor. So, we've been talking about the childhood trauma and some kind of, let's say, cases about, let's say, the medical conditions. Let's talk about the bullying, doctor.
This is a very sensitive topic. Everybody maybe had been subjected to bullying in let's say a period of time, especially when it comes to middle school, especially when it comes to primary school. So these children we have noticed that mostly were subjected to a different kind of conditions later on. Yeah. Most of them are ADHD, OCD and depression, even in let's say teenager-wise. So most teenagers would come to us, let's say, complaining of sadness, complaining of apathy, complaining of depression itself. So when we ask them what's going on, they are being bullied in school. So there should be like a raised in the awareness when it comes to dealing with teachers. How are they dealing with when a child comes to them and he's subjected to bullying from his peers or from his, let's say, friends? So are they dealing with it accordingly? Are they giving the child some sort of a security, some sort of a belonging that you're safe with us? Because most schools nowadays don't do that, let's say, in a very strict manner. So a child would come to the teacher and tell her or tell him, I am subjected to bullying. The teacher himself would be, what should I do? Wait, should I call someone? Why can't we raise awareness with teachers on how to deal with these type of occasions when it happens?
Yes.
So bullying itself, it is a stressful event. Maybe it can be turned into a traumatic event as well. We should know that all traumatic events are stressful, but not all stressful events are traumatic.
Yes.
So maybe the bullying itself was stressful for a period of time, but it's not traumatic later on, but it can be. So we need to understand the child that he's being subjected to bullying. Are you feeling like you're not safe when you go to this school? Or are you managing to maybe build the relationships with your friends? Or maybe you're just scared and you're being bullied all day long, sorry.
And also in addition, Dr. Abdullah Khanfar, let's talk about the child with the special needs, which will suffer from autism.
Yeah.
I know the autism, they are already interacting with us, but in a different way. So and you are a doctor. How you are communicating with them to make them more social?
So let's say the problem we face as physicians when it comes to autistic people is that they already have their inner world.
Yes.
They're already living in their inner world, but they're so smart. So when you ask them a question accordingly, when you know how to speak to them, they would answer in a very smart way. So how to deal with them is to understand that they're already in their inner bubble. And they're already in their inner world. So we cannot interfere with that world. But if it's let's say, major, if it's maybe the child himself is suffering from pain and cannot express that pain, we need to know the signs that shows on the child himself, and we need to acknowledge that with the mother or with the father. Are you able to acknowledge the pain if the autistic child is suffering or not? Can you see his expression, even though most of them cannot express, but they can pull a tantrum? Yes. They can scream, they can feel agitated. So that may be an indication of some sort of a pain. Maybe he's having abdominal cramps. And we do see patients in family medicine as well. Maybe they come to us with, let's say, constipation, abdominal pain, but they cannot express it. So here comes the physical aspect of medicine. So I need to do a proper physical examination when it comes to the patient himself. Maybe he's suffering from abdominal distension. He would not say that, but the physicality would show
appears.
That. Yes. Yeah.
And you mentioned, doctor, about the parents and the families that they do have learned their children, let's say, language as well, to deal with them, and also the teachers to deal with the classmates, the bullied. So how actually, or let's say, can you please mention some of the situations that the families or the parents or even the teachers that cross by to you and say, I don't know actually how to deal with my child, for example?
So most children would come to us. Let's say we're talking about the bullying aspect.
Yes.
They would tell us we need sick leaves. I don't want to go to school. So here comes my part in this type of a situation. What's going on in the school? Why do you want? Maybe most people, they do some sort of somatization, which is the invention of a disease. I have a stomach ache, the child would say to his mom, even though he's lying. So he does not want to go to school because he's being bullied. And we would discover that when we ask the proper questions in the clinic. Are you being bullied? What's going on? Who hits you? We do have, let's say, physical trauma. Maybe the child was beaten, maybe the child was, let's say, thrown on the floor, and there would be bruises. So the first question I would ask the child, not the mother, are you beaten? Because the mother would believe the teacher, he was thrown on the floor accidentally.
Yes.
No, we need to ask deeper questions when it comes to these type of incidents. Are you thrown accidentally or something happened to you?
Yes.
And here we would identify that if the child is being bullied or the child is being, like, let's say, accidentally handled.
And even in addition, doctor, we spoke about something important. A child will have like drug addicted. I know, like
sure.
this is very important topic. Like, you know, the state of Kuwait now, they are raising awareness everywhere. If you go on the roads, you will see, like we call it in Arabic, you watch out from your friends. Yeah.
Because they might. This is one aspect when it comes to addiction.
Yes.
So most of us, when we deal with addiction, we would blame others.
Yes.
Most of us, when we deal with addiction, we blame genetics.
Okay.
But addiction, sometimes the effect of addiction comes from the environment.
Okay.
Was it a stressful environment for you? So how
Nice.
can we, let's say, help this addicted, and let's also put in mind that addiction itself has a stigma.
Yes.
If he's an addict, don't go near him. If he's an addict, don't deal with him. That's what a normal individual might say. But as a doctor, I need to ask some intimate questions. Why are you addicted? What are you escaping?
Yes.
Because most people would tell you the addiction itself would let him escape from reality. So what's going on with your reality? Is these questions are being asked to the patients or to the addict himself? Is your reality stressful or relaxed? What's going on with your relationships? Are you being stressed all the time? Are you escaping during these drugs, alcohol, you name it? So the addiction can be in a various way, not just alcohol and drugs. It can be food, it can be social media, scrolling 24/7.
Yes.
And we are victims of that nowadays. And it also can be binge eating.
Yes.
So all of these patients, we need to ask them, what's going on inside of you? Is this addiction helping you accommodate life daily?
Yes.
Or is this addiction helping you survive? Because most addictive people would consider suicide at the end of the day. I know it's a sensitive topic, but we need to address it. So are you escaping? What's going on? Let's deal with your inner world. So some people would say substance do have some sort of, let's say, I feel I'm belonging to something when I'm addicted to something. So why do you feel that feeling? Do you feel like there is
attached, maybe?
Exactly, there is some sort of attachment as well.
Feel in a new world, let's say.
Exactly. So even when he introduced himself to a new addict, he feels like he belongs to a community.
Yes.
But we need to regain his, let's say, trust.
Again.
We reconstruct his, let's say, beliefs again. And this community is addictive. You need to come to a healthier community so that you can survive, or not just survive, you can live your life authentically.
That's amazing. So, doctor, let's talk about the most common, let's say, psychological cases or issues, especially after the pandemic. I know the OCD people who are suffering from OCD really increased after the pandemic.
So OCD and generalized stress anxiety disorders, let's say, or generalized anxiety disorders as well. So most people, they develop, let's say, these phobias of catching a disease, or maybe they are sick in some way. We need to deal with these patients on how are you dealing with yourself on a daily basis.
Yes.
Do you feel like you will catch a viral every time you catch a cold? Because some patients would seek medical help the moment he feels like he has a sore throat. Even though prior to the pandemic, he would wait a month. He would wait 2 weeks before seeking our help. But nowadays, slightly sore throat, he would seek a medical attention. Am I having a viral infection? What's going on with me? Do I need to do a blood test? So it's not an OCD, more likely a stress or a generalized anxiety disorder.
Yes.
Let's say an anxiety because of what happened. So this is a trauma itself.
Yes.
COVID by itself was a trauma. So the patient needs to remind himself that COVID is minimized now. You're immune, you have a vaccine. This will help you, let's say, or will protect you. So this is one aspect of dealing with that topic.
Yes.
And also, doctor, because see the most important cases, we mentioned more than 8 cases in the studio today.
Yeah.
So if we want to roll up all of these kind of cases as you as a responsibility and working in the medicine field, how can you, as you and all the doctors in the same major, raise the awareness to the community?
Okay.
Yeah, what do you think, like through social medias, giving instructions, what do you think?
When we notice nowadays in social media, everybody is talking about these subjects, by the way.
Yes.
Everybody is talking about trauma, everybody is talking about raising awareness on variant, let's say, conditions that we talked about. But you need to be selective.
Nice.
When it comes to knowledge. Even having this type of a huge knowledge, even having this type of, let's say, raised in awareness, sometimes can be misleading. So know your knowledge, know your source. Don't just take, we have this when it comes to our mothers. They would see like a viral video through WhatsApp, through like Instagram, they would believe it. But they should be selective when it comes to the knowledge that they see through social media. Yes. You need to know the studies. Is it study based? Is it like based on patients that were treated and they were like, let's say, cured? Okay, so raising awareness, first of all, we can help the patient deal with his emotions.
Yes.
If you have a stressful partner, you need to deal with him. If you have like a stressful, let's say, event that happened to you, don't just suppress it. If you have a feeling attached to that stress, deal with the feeling. If you have physical symptoms because of that stress, know that these physical symptoms are not related to just medical conditions. Yes. Maybe it's related to the grief that you're facing. Maybe it's related to the anger that you're suppressing. Us men do have suppressed anger. And based on studies, it showed that they have prostate cancer later on. Women as well, when they don't express their emotions, they have autoimmune diseases later on.
In the future.
So they need to acknowledge that not all conditions they develop is by coincidence. They need to, let's say, regulate their nervous system, regulate their psyche, their self. They need to express their authentic self. Yes. Because the suppression of self itself would cause you stressful events or stressful conditions later on.
So, doctor, what are your goals and inspiration in the field of the family medicine, childhood trauma?
So we have like let's say different type of goals. First of all, to have a clinic, to have like a special clinic on dealing with the trauma itself. Mm-hmm. To have clinics to deal with like what's going on with the patient on an intimate level. What's going on with your life? Why do you have these certain, let's say, physical symptoms? Because we have, let's say, a lot of patients that comes to us daily with the same symptoms, not knowing what's the reason or why is he suffering from that. Yes. And when we investigate, we would discover that the patient is going through a very depressing period and he does not even know that. So we need to, let's say, change our aspects of questionnaires that we ask to the patient. First question, I would say, how's your relationship with yourself? Are you happy inwardly? Are you seeking substance to, let's say, sedate yourself? Are you seeking pleasure outwards, even though pleasure comes or the source of pleasure comes inwardly, not just outwardly? And let's also not forget that because of our culture, we obsess about materialism. Materialism also causes some sort of stress to look certain way, to have certain objects. Yes. These type of things, when you obsess about them, would cause you stress. Because maybe you would compare yourself to other peers. You might not have what they have, and that would cause also stress on you or pressure. So the type of a materialism that we're facing nowadays also contributes on the stressful events that we see in patients.
Mm-hmm.
Nice.
So raising awareness towards trauma in general, whether it's childhood trauma, whether it's trauma itself, dealing with your emotions, being your authentic self, expressing yourself, and have some sort of compassion. So these are our goals nowadays, to change our questionnaires, to change our, let's say, approach to patients.
Amazing. That's why even all the things you mentioned, well, thank you so much for giving like too much about your concern, and we are believing the Ministry of Health will applying and all your colleagues to give like this thing an important, because the more people are attached now for their traumas,
yes.
Now it's your duty to clear everything.
Nowadays they're acknowledged with their trauma, they're acknowledged on how to deal with it.
Yes.
And even though I encourage my colleagues, my doctors to change their approach, medicine has changed, so they need to change their questionnaires, their way of approaching, their way of treatment, and that would help as well.
That's amazing, Doctor. It was really an interesting, important topic. It's not actually affecting the individuals, even the whole community, the whole society. And thank you for being here.
Thank you for having me. Thank you so much.
So we are speaking to today Dr. Abdullah Khanfar. He is already a family medicine. He already shared with us about his way of treatment, what about the childhood trauma, about the self-healing, about too many different cases. We'll talk about the autism, we spoke about the drug addicted, we spoke about ADHD, we spoke about too many different topics which refer to our child. So we guess we finished our episode for today. Hope you enjoyed today our episode with our distinguished guests. See you next time. Have a good day.
Have a lovely day. Bye-bye.